So, hip and knee arthritis in general is thought about as wear and tear of your joint. So, there's a gliding surface at the end of your bones that allows you to have a joint either at the hip or at the knee. And essentially, what arthritis is that gliding surface starts to break down, and then the bone gets exposed and gets irritated, causing pain and swelling. And so that's what arthritis really is. People want to know, what is arthritis? It's not something that's put in the joint, it's something that you lost that you normally have. And usually that's a wear and tear factor. There's many causes to it. A big cause is genetics. So if your parents had hip or knee replacements or bad arthritis, unfortunately there's a good chance you may have that. It could also be from a trauma you had as a teenager or a child where you damaged the joint or you needed a knee surgery early in your life. Later in life, there's a good chance you may develop some arthritis. More specifically for the hip, there's a lot of disorders that come about just from your development as a child. There's one called developmental dysplasia of the hip, and there's one called hip impingement that a lot of young people get, and they may end up with arthritis even in their 30s, 40s, 50s for the hip. But again, the vast majority of people we see with arthritis, both of the knee and the hip, are 50 years old or older because it's mostly a wear and tear phenomenon. So when you know it's time to see somebody about it is when it's interfering with your quality of life, really your ability to function on a day-to-day basis, and you've kind of done the basic things on your own to try and treat that, and you're still like, what is going on with my knee or hip? I can't do anything. That's the time to really seek some help. Conservative care for knee and hip arthritis is often looked at as non-surgical care. And a lot of this is done oftentimes by a primary care provider or a PA or a nurse practitioner, often before you even see an orthopedic surgeon. But typically it's considered non-surgical. Being a surgeon, I always like to tell people, though, sometimes if they're bad enough or far enough down the line when they first come to see us, sometimes surgery is the most conservative option. But if you look at more traditional conservative options, it's everything you've probably thought of and your mom told you about when you injured something growing up. It's looking at, okay, how can I modify my activities? So if it hurts with activity-based things like standing, walking, or doing a lot of activity, then you got to back off on that or find a different type of activity. For instance, low-impact exercises like biking, swimming, or walking are better typically than running or jumping type sports or sports where you have to cut, turn, and pivot, because those put a lot more stress on your hip and knee joints. So that's really the first hallmark, is just modifying your activities. It's simple, it's easy, and you'd be surprised at the number of people where you ask them to really do that and they do it and they're like, wow, I feel way better. Now, sometimes they're not satisfied with their level of activity, and in that case, often you go on to the next step of non-surgical care, which is often medicines. And traditionally, that's what's called a non-steroidal anti-inflammatory medicine. Medicines in that class would be like ibuprofen, Advil, naproxen, or naproxen. And people would use those typically over the counter initially, and sometimes that's enough to take care of them. Now, some people can't take those medications because they're on blood thinners, and there are other options for them to do that. A guided physical therapy program is a great option for early arthritis, particularly of the knee. There's been a number of studies that have shown this guided program where you're taught exercises to strengthen your core, your muscles around your hip, and your muscles around the knee, actually improve people's pain, function, and can delay going down the pathway further with their arthritis. So that's a really good option for people. There are other options, in particular for knee arthritis. Some people like to try braces for knee arthritis. There's very specialized braces. Some people they work in, some people they don't work at all for. But it's an option that's short of surgery or something very invasive or interventional. As you get further down the track, there are shots you can get in your knee. Now, I will say, if you look at the evidence behind those shots, there isn't great evidence that any of them do much for you long term. I tend to use a steroid injection because it's cheap, It's easy, it's one shot. There are also gel injections, which have really fallen out of favor. Our American Academy of Orthopedic Surgeons says they don't work that well. There are all kinds of growth factors now that people are trying to inject, but we really just don't have enough evidence about those now. So that's a big thing. Injections, they might help short term, but we don't think they do much long term. Another very basic one that people forget about is just losing weight. And most of the studies have shown that if you lose 10 pounds, it reduces the stress on your joints and can make a difference for you. For instance, you lose 10 pounds, they think that's like losing 30 to 50 pounds of stress through your hip or your knee, and that just reduces the inflammation and oftentimes can make people feel better. So that's just kind of a brief overview of the conservative measures. There are a bunch of other things out there that we just don't have evidence on that people try. The good news is very few of them are harmful to people. The bad news is they might cost you money, but you're certainly free to try them. Things like acupuncture or tart cherry concentrate or glucosamine. All those things are out there, but really have no evidence that they help. But a lot of patients just feel better that they're trying everything they can before surgery. But again, for some people, surgery is really the conservative answer because their hip or their knee is so bad and they've waited so long to come in that those other things just aren't going to help them.